Good morning, everybody. This is Debbie Lynn Toomey, Tufts Medical Center's injury prevention and outreach professional. And today you're joining Aging Strong, which can be found under Health Links at QATV. I want to thank the Quincy Health Department for the continued sponsorship and partnership for helping me do my outreach program in this manner. Aging Strong is an injury prevention and outreach program that's dedicated to sharing information and resources that empowers older adults. Today's topic is on loneliness. Did you know, I was just reading an article, did you know that being lonely, according to a meta-analysis that was done in 2015, being lonely is a health equivalent of smoking 15 cigarettes a day. So let me repeat that. Being lonely has a health equivalent of smoking 15 cigarettes a day, and that's based on a 2015 meta-analysis. That's pretty scary. Research says that loneliness and social isolations are twice as harmful to physical and mental health as obesity. That's pretty serious, And today we have a guest expert. She is Sandra B. Harris, State President, AARP Massachusetts, co-chair, Massachusetts Task Force to End Loneliness and Build Community. Sandra, welcome.
Thank you so much, Debbie, for the introduction, and good morning, everyone. It certainly is my pleasure to be here to use this time to share the work that we're doing on the task force. Loneliness is an emotion that we all have to endure from time to time. And if you're feeling blue, especially this time of the year, know that it's normal and that you're not alone. My goal today is to provide an overview of the work that we're doing on the task force, to share some of the lessons we've learned, hopefully to get some feedback from you, because one of our guiding principles is to really stay in touch with our communities, to really understand what the residents and people on the ground are feeling. So we welcome any feedback that you might have, either as part of this conversation or if you'd like to be in touch with me about that. And lastly, I'd like to share the 2023 priorities of AARP Massachusetts. So let's get started. First, I'll give you an overview of the task force. Why do we exist? Our work began in the fall of 2019, prior to the pandemic, when we began to notice not only a worldwide loneliness epidemic, but also we began to see how it was being manifested and affecting our communities. And of course, all of this became worsened by COVID. We knew at the time that there were 540,000 Massachusetts residents older than 50 plus who were living alone. And not all of them were lonely, but all were certainly at a risk for social isolation and loneliness. And lastly, because the loneliness, social isolation is such a multi-complex issue, community leaders, organizations, and residents were knocking our door, calling for help, asking us for help. What are we? We began, as I said, we began with 6 to 7 organizations, and when we began to hear this call to action, and together we decided to move out of our silos, to combine our resources and ingenuity, and for greater impact in addressing this epidemic. Today, we are a statewide coalition of 44 plus partner organizations with the mission of ensuring that all residents of the Commonwealth feel connected to the community and enjoy a strong sense of social well-being. The very first thing that we did was we developed what we consider our guiding principles. What are the principles that we wanted to guide the work that we were doing? We wanted to make sure that our work was community-based and grassrooted, that we were not sitting in our offices, our ivory tower, dictating what should be done in the communities. We really wanted to understand how this was being manifested, how people were feeling, what first responders were seeing, and other community organizations were finding. We wanted it to be a statewide partnership. We wanted to make sure that we allowed opportunities for any state organization, any resident, or other communities who were interested to be a part of this work. We wanted to build on existing promising practices. We found that there was no need to start from zero. And if we found ideas that were working in community and that were making a difference, we decided that we wanted to promote them and share them. We wanted to make sure that whatever we shared or promoted were small, actionable solutions that could easily be replicated in community. And lastly, we wanted to work to begin to do some research that provided evidence that what we were doing was making a difference. So here's some of our key accomplishments. The very first thing that we did was trying to understand how this was being manifested in our communities. We held 4 regional conversations around Massachusetts. Our plan at the time was to kind of do those in person, but then COVID appeared and we very quickly, like most programs, had to pivot to an online solution. And we had, within these 4 community conversations, we had approximately 335 participants, really people showing up, letting us know what they were finding in their communities, what they were seeing, and what was some of the things that they were doing and the help that was needed. The biggest lesson that we learned was there was just a lack of awareness. As Debbie talked about, the impact of loneliness and social isolation on well-being was just not being understood. So on National Good Neighbor Day, which is on September 28th of 2020, we created a public awareness campaign. The other thing that we saw very clearly, and also with the convergence of COVID, there was really a digital divide. I mean, think in terms of the dismal failure of the vaccine rollout, right? That we assume that people have the resources or the digital literacy to stay connected and to know how to get online, to understand that. And we found that that didn't work, that there were some adults some people who could manage and navigate the system, but others, more did not. So we created a technology collaborative that promotes the importance of digital literacy, to provide resources to help community organizations like senior centers to provide programs in addressing this with their residents. We also learned that loneliness and social isolation does not discriminate. That we found that there were different cohorts. Research tells us that young people between the ages of 18 and 25 are just as lonely, if not more lonely, but they were siloed. So what we agreed to do was to really develop a multi-generational approach to all of the work that we've done. And lastly, we found that older adults, those who were willing to talk with us, felt that their voices were not being heard. And so we created a space where we encourage and invite older adults to be around our table to provide feedback and to from whom we can listen and learn from. So our campaign, #ReachOutMassachusetts, which we launched in September 2020, is a series of public service announcements by public officials and community leaders. We do a lot of posting on social media and newsletters. We work very closely with the Mass Councils on Aging, that they're included in their newsletter. And we shared 10 small, safe ways to reach out, especially when COVID appeared. The campaign is launched several times a year to make sure that we stay current, reminding people to continue to reach out in small ways. Also, we develop a downloadable catalog of programs that we're working in different communities. And it's on our website in lonelinessma.com for people who are interested in getting an idea of what are some of the programs and activities that are working in the other communities. We want to stay in touch with our members and to really provide feedback to our communities and residents and community leaders. We host an annual summit on National Good Neighbor Day, which is September 28th of each year. When this is we do this on a virtual platform because we want to make sure that we are accessible to communities and residents around the state. So it is done on Zoom. We encourage and welcome watch parties and we've had some watch parties from some of the senior centers where they invite their community members to come in, together listen to the work that we're doing, to stimulate conversation and to provide feedback of the work that we're doing. In 2020, which was our first annual summit, we featured Lisa Rison, who is the past president of the AARP Foundation. 2021, Risa Wilkinson, who is the executive director of Healthy Places by Design. And our last summit in 2022 was Mark Freeman keynoted, and Mark is the co-CEO of CoGenerate, which is formerly known as Encore.org. We have launched a monthly TV series that is hosted on community media channels across Massachusetts. The program is called Connect. There, we explore themes related to loneliness, social connections, and healthy aging. You can visit our website, again, at endlonelinessma.com to look at prior episodes. It's actually being produced at the WinCam studio in Winchester, and it's downloadable. And if your community is not getting it, we encourage you to have them download it. But it's a monthly 30-minute program. As we move forward, here's some areas that we are beginning to concentrate on starting in this year, January of 2023. As we continue our on-the-ground efforts, and we don't plan to abandon any of the work that we're doing, working in communities, we know that just asking people to reach out is just not enough. We must begin to address and advocate for those systemic structures that lead to loneliness and social isolation. These include a lack of outdoor and public space that are safe, welcoming, and culturally relevant. We are very pleased to announce that due to the generosity of the John Hancock Foundation, we are piloting 2 programs, Activate Boston, in which they have provided funds for 2 communities to activate active outdoor spaces. These communities, the design of these communities are being led by the residents themselves to make sure it is what is going to be meaningful and resonates with them. We also have started and bringing to the U.S., and many of you may have heard of it, the Happy to Chat benches. It's a program that's very popular in the UK and other countries, but it's simply a bench with a sign on it that says, "Sit here if you'd like to chat." And this is where we are inviting people, if you're feeling alone, just come here and encourage people to come in and chat and make connections with others. It is also a program that is working very well. We're hearing in school systems where they have buddy benches where kids who are feeling alone can go to the buddy bench and a buddy could come in and talk with them. You may have seen a recent article in the Boston Globe talking about the Happy to Chat bench in Salem. So that's going well. And we're going to continue to promote these in safe places and for communities throughout the Commonwealth. As pointed out in a recent New York Times article, our housing stock has grown out of sync with our demographic changes. And it's now time to look at new, affordable, and accessible housing options. We're really looking at ADUs, our accessory dwelling units, more intergenerational models, home sharing, co-sharing houses that allow people to live closer together to stay connected. And lastly, one of our efforts for this coming year and beyond is we need to rethink and advocate for new modes of transportations that allow people to move safely and conveniently from one place to the other. And this is especially important for older adults who are no longer driving. Providing options for new, safe, affordable ride-sharing programs, for example. So those are what we call the systemic structure that we want to begin looking at. And we feel that as we, as a country, as a nation, as a community, begin to address these, then that will go a long way in helping us to address this epidemic of loneliness and social isolation. What are some lessons we learned? As I've stated before, we've learned that there was just a lack of awareness of the benefits of staying connected. People didn't understand. They didn't understand the value of staying connected and the risk of loneliness to well-being. We also learned that there's a stigma attached. A lot of people who found themselves in this loneliness space did not define themselves, or they were not defining themselves as being lonely because of the stigma attached. And we want, and the message that we're putting out is there is just no need to feel badly about this, that you are not alone if you're feeling lonely. We found that there was a difference between loneliness and solitude or isolation. Everyone who is alone is not lonely. I know there are times when I value my solitude, when I would prefer to be at home reading a good book or even playing a game on my computer, right? Also, you can be alone in a room full of people. So there's a big difference between loneliness and solitude, where loneliness is just a subjective, unpleasant feeling of just being isolated, a perceived discrepancy between what you want and what you actually experience and what you want. Whereas isolation is just that you're just not connected to people for whatever the reasons might be. We also learned, and research is supporting, that young adults between the ages of 18 and 25 are now considered the most lonely. And there is a digital divide. It is just always good to see that so many adults are embracing technology and Zoom and staying active that way. But there are just far too many who have not, far too many who don't have the resources to either afford Wi-Fi or devices, or just don't know how to use it. So we know that we have to do a better job of that and make sure that no one is being left behind in our ever-evolving e-society. The other thing that we all know is that the pandemic has created a crisis of habitual loneliness, and individual efforts are needed. We must try harder to return to our pre-pandemic activities. I know that's difficult for me. I have to force myself to go out and do more things while simultaneously being safe and making sure that I am not allowing myself to stay in that little box that I have created for myself as a part of this pandemic. What's working? One of the things that we tell people is that, as we age, our life experiences bring knowledge and wisdom. We just have so much as older adults, and I know I'm there. I consider myself, when I consider the alternative, I am an older adult, and I will be one as long as I can. But as we age, we still have so much to offer, and we have to value and honor ourselves, our wisdom and experience, because all that makes a difference in how we feel. Finding ways to add meaning and purpose to life. Find a reason to get up every morning. What is it that you've always wanted to do, but life just got in the way? Right? Maybe it's time to write that book you've always wanted to, right? Or learn a new skill. Or as Mark Freeman challenges us, every child needs at least one adult who is irrationally crazy about him or her. Maybe it's time to find that child. We can reach out to your neighbors, loved ones, and friends whom you have lost connection. I have just reconnected to a high school friend, where every day we shared the same seat on the bus. And after almost, 35 years, I've not heard from him, but I've just found him and reconnected to him. And we try to stay in touch at least once a month. And it's amazing how our, lives have differed, and the places we've been have been so different. And to be able to talk about it and to talk about the conversations that we had as we rode the bus home. Volunteering and giving back to the community makes a big difference, not only to the people that you're helping, but also to how you feel about yourself. Embracing technology is important. Being able to share a meal on Zoom, or I spend a lot of time reading to my grandkids at night who live in Nashville, Tennessee, on Zoom. That embracing technology, again, as we continue to move to an e-society, that's critically important. And there's always something to learn, right? So besides acquiring new knowledge, excuse me, helps our brain to stay mentally sharp and intellectually stimulating. Lifelong learning also allows us to connect with people of similar interests, allowing us to continue making friends. Pickleball, anyone? Okay, what can you do as you're sitting here listening to this conversation? What can you do? You certainly can join our campaign. You can reach out to someone that you know is living in loneliness, perhaps a neighbor that you've not seen that you know is living alone. You can help us elevate the voices and stories of those people living in loneliness. Storytelling is very big, and the more stories that we're able to capture, the more successful and effective that we can be in advocating for changes that would help us to address this loneliness and social isolation epidemic. We can embrace and share our wisdom, our experience, and our talents with our communities. A number of councils on aging, or even a number of our communities are now age-friendly communities. Get involved in your community, and there's a lot to be done there. We can encourage co-generational activities in the community, reach out to schools and, encourage young people to get involved. Because as I say, oftentimes we're finding that just reaching out to a young person who's also living in loneliness not only helps your life, but helps theirs as well. You can visit and learn more again at our website, www.endlonelinessma.com. Now, I'd like to move on to ARP Massachusetts and our programs and priorities. ARP is a nonprofit, nonpartisan organization that empowers people to choose how they live as they age. We advocate on issues that affect residents at the local, state, and national level. Our membership nationwide is over 38 million, and we have approximately 750,000 members here in Massachusetts. Here's the basics. ARP does not endorse candidates or elected officials. We do not give money to candidates or elected officials, and we do not have or donate to any political action committee. What we do is we advocate on issues that matter to people 50 plus. We work across political lines, and we provide factual information on where candidates stand on key 50 plus issues. More facts. America's 50 plus are our nation's most powerful voters. We provide Americans 50 plus with trusted information, and we fight to make sure that the voices of Americans are heard on issues that matter, issues like Social Security and Medicare. And we fight to make sure that candidates keep their promise. Our national priorities for this year is we want to make sure that we are defending and protecting Social Security and Medicare. And, we don't need to go into it. I'm sure you're seeing the news and what's going on in the country. And we know that it's important to protect Social Security and Medicare, which is a lifeline for older adults. On the state level, our priorities include promoting, advocating for a family caregiving tax credit. The average caregiver pays over $7,000 yearly out of their pocket. So we are promoting a bill that provide a state tax credit up to $1,500 for eligible caregivers to help cover their costs. The other thing that we're working on is nursing home reform. I mean, we don't have to think hard about that one, right? We all know that, again, dismal failure of the nursing homes during COVID. So we're really working on pushing some priorities and some, for example, increasing the minimum nursing ratio, enhancing their preparedness and response, and when there's an infectious disease outbreak, and making sure that each nursing home has a DPH provided approved isolation prevention plan. The other thing that's higher on our priority list for 2023 is property tax deferment, which supports a change to the current law on senior property tax deferral. And we're going to be working on that, and you'll be hearing more about that. So what can you do to help us? You can join the ARP advocacy volunteer team by becoming an activist. Check us out at mobilize.us/ARP Massachusetts. We have a First Friday call where we talk about our priorities and our plan of action. That happens on the first Friday of every month at 10 a.m. And you can just sign up with us to meet and talk with your elected officials. We're always looking for stories and for people to testify at hearings. And we encourage you to make your voice heard, especially on all those issues that are impacting 50 plus. We have a very strong outreach department, research. What we're working on this coming year and concentrating on includes fraud prevention. We're promoting the financial resilience, including savings, plannings, and prepping for retirement, encouraging people to do that. We also provide a lot of volunteer opportunities. We invite people throughout the state to bring their interests, talents, and skill sets to help us make a difference in the community and to remain connected. And we are supporting the age and dementia-friendly movement throughout Massachusetts. For more information, you can visit us on the web at aarp.org/MA, on Facebook /AARPMA, and on Twitter @AARPMA. So this concludes my presentation. I like to always end with the motto of our founder, Dr. Ethel Purser Andrews: "We're here to serve and not to be served." So thank you for this opportunity, and I look forward to any questions or feedback you might provide.
Sandra, that was wonderful, absolutely wonderful. So much information that you shared with us. In a nutshell, I'm thinking that. Do you think that it's everybody's responsibility to help end loneliness? And as far as what little actions that we can do as maybe a neighbor or a friend or a coworker, what do you think, what are some ideas that we could offer to others who want to help, but just don't know where to begin?
Well, one of the first things that I would suggest to people is to, become a part of the work of the task force. We meet once a month on the first Thursday of each month at 11:15. It's only for an hour. There you learn a lot. Not only do you learn about what the task force is doing, but we're finding that it is a great opportunity to network and to find people in your communities and get connected there. We do a lot of presentations on ways of staying involved. For example, going to your local library. The libraries are just no longer for checking out books, It's really has become almost like a community center, right, where people can connect. The other thing that we suggest, especially for people who are reluctant to begin to step out of that the pandemic mode, is to do volunteer work. You can volunteer from home. There are a number of opportunities. And on a one-to-one level, little small things like, picking up the telephone and calling in someone, who is living alone, and just say, "I was thinking about you. How are you doing? Do you need anything?" Write a card, send a card, or write a letter, set up a Zoom conversation. There's just so many little things. It's just kind of look outward and how you can reach out to another person. And you will be surprised at the difference that it makes in your life when you kind of just reach out to someone else. And, another thing that we always encourage at our National Good Neighbor Day is remind people to renew their social contract. You remember Mr. Rogers' Neighborhood and all we learned from that about what it means to be a good neighbor, to connect with your neighbor, to say hello, to smile, just little things that make a difference.
Yeah, very good points. Very good points. The slide where you had what's working, valuing self and honoring one's wisdom and experiences, adding meaning and purpose to life, reaching out to neighbors, volunteering, embracing technology, committing to lifelong learning. There's so much on that slide that we could probably do an extra hour just talking about it. And what comes to mind is a while back, I studied positive psychology, the science of happiness and optimum health and well-being, and how important it is to have a meaning and purpose, a way for us to get out of bed, to help us to get motivated, and how when you volunteer, it's actually, there's research that has shown that it helps cancel out or even decrease depression, because when you're volunteering, you're doing something for another person. You stop ruminating on the depths of your despair and how important it is for us human beings to connect with others. And there's a long study. I think it's about 50 years old now, the study that's being done at Harvard, how they have shown that meaningful relationships is actually a key in helping people live a long and happy life. So there are researchers out there who are studying meaning and purpose, how important it is, and volunteering, and how when we can become lifelong learners, how we can be curious, how really that gets the juices going, and how it can help us get out of ourselves and really expand and continue to grow no matter how old we are.
Debbie, you're so right. You could have done this presentation. Next time I'll have you do that slide. So important. We are wired to be social creatures. We're wired for connections, right? And some of us, are reluctant to admit that or won't allow that to come out in us. And that's okay if you're happy and content where you are. But having connections and being able to reach out and help is so important. And so many times, especially as the state president, when I talk to older adults, when I'm invited to senior centers, to the legislative districts or areas to talk about to older adults, the very first thing I said is, look, let's feel good about who we are. Just think about all the history we have, all the experience that we have. We have so much, and we can't forget about that. And I'm glad that you brought up the project at Harvard, which is being led by Dr. Bob Waldinger. I think his book was just released on January 10th, and it's A Happy Life. And Bob is going to be featured in our April episode of Connect, which is our TV program. So I'm really, really excited. I'm the host of that program, and I'm really excited to hear what Bob has to say. But, when you look at as I'm reading the book, what it comes down to is staying connected. It's not about how much money you make. It's not about how many titles you have around behind your name or degrees. It's about being in healthy, loving relationships and making connections. That's what leads to a happy life.
I agree, because it's not really having thousands of friends, because we could have, look at Facebook, right? Oh, we have 1,000 friends on Facebook. But it's really that one or two or three that you can just kind of be yourself and be authentic and be ugly and be sloppy with, and they'll accept you for who you are. And having those type of connections throughout your life is just so important. And as mammals, right? We're human beings, but we're mammals. They've shown that in the animal kingdom, it's important to travel in packs, because if you are that one loner, you are so vulnerable to predators. And that's really not much different from being a human being, because sometimes being in that state of perpetual loneliness sometimes can be so, you just don't know what's out there, or people may see that, oh, that person's by themselves, and you could be very vulnerable. So, I don't know. It's just, it just brings up a lot of, emotions, I guess. It's that's why I really wanted to have you on today to talk about loneliness. And even before COVID, it was, the rates of loneliness was pretty high, right?
Well, it's really interesting because I saw an article just last night I was reading, and Boston is one of the loneliest cities, right? Did you see that article? I'm trying to remember where I read it, but it was just yesterday. I came across that, and I guess living in Boston, maybe I shouldn't be surprised. But I think, I live in the South End, I have a condo in the South End. And, if you have a child or a dog, I know you, right? But so many people live so close together and they don't really take the time to say hello or to learn more about their neighbors. So, one of the other things that we're promoting is a lot of placemaking activities, things like, where you one Sunday afternoon, you close off a street and have a block party just to get to know your neighbors, right? So there's just so many little things that we in community can do, and we encourage people to do. There was a time when we did all those things, and I think we have to, some of the things that we've lost, and we have to return to those.
Oh my goodness. Yes. I remember when my family and I were traveling, we went to Montreal, and we were just walking in the city, and there were some parts of the city where they had big, giant chessboards. And it was just to see strangers, just kind of, interacting, it invited fun, and it invited people to kind of just gather. And how beautiful that would be to be able to have that in areas where people they don't even have to participate, but just feel like they're being a part of something.
Right. So I encourage our viewing audience today to, create a chessboard and a giant chessboard in your neighborhood, right? And just some activity. I did a presentation recently, and we were talking about the Happy to Chat bench, and someone was telling me that he was on a college campus once, and it was not a Happy to Chat bench, but there was just a man sitting there saying, would you like to chat with me? And he said when he passed the guy going to his destination, the guy had an audience, and coming back, he had a totally different audience. So I think people are open to it. People are, especially young people, I think they're reaching out, and although they have contacts and stay very active on social media and Facebook, it's just not the same to actually having someone that you can share a conversation eyeball to eyeball, and to get their expression, and to feel that not only their vulnerability, but, their honesty, right?
Yeah. Wow. Yeah. I really, when you shared about the Happy to Chat bench, I just thought that was such a fabulous idea. It's so inviting. And yes, really, there's no pressure, right? And it's just a way for people to just sit and have that moment of company that could be maybe the best part of their day. I don't know.
Right. It certainly beats, sitting down in your home, looking out the window, kind of feeling alone and wishing there was some place that you can go. And so we have our work to do. So Debbie, I'm looking forward to you helping us to promote the Happy to Bench concept in Massachusetts.
Oh my gosh, I would really love that. Now, to be a part of the initiative, to volunteer as part of AARP, do you have to be a member?
We certainly encourage you to be a member. I don't think that you necessarily have to be a member, and you certainly don't have to be a member of the of AARP to be a part of the task force. The task force is convened by AARP Massachusetts, but it belongs to all of the partner organizations that have come together to, maximize their impact for the greater good. So we're only convened by AARP. So you don't have to be a member to be of AARP to be a member of the task force, but we certainly encourage it because I think we not only offer a lot of rewards and other kinds of things. But it's a wonderful program. We have a wonderful bulletin and newsletter that's award winning, and people find that when they get this or get involved, how it makes a difference in their lives.
That's great. So again, that's to become an e-activist. The website to go to is mobilize.us//AARPMA. So yeah. The calls are the first Fridays of the month at 10 a.m. Okay, yeah. That's good to know. That's good for people to know because I'm not sure if they feel like they have to be members to be a part of that, to be a part of a change that we want to see in the world. Would you be able to speak a little bit about, I was really surprised when you shared that young adults 18 to 25 are now considered the most lonely. Why do you think that is?
Well, I actually had a recent conversation with a psychologist about that. And my question was not that it's surprising to me because I've been doing this work for such a long time, but I have just been seeing this research creep into my readings. And it has to do with the fact that, that they are very much involved in technology. And we're not sure with, especially Facebook, is the way to stay connected. Because oftentimes, it's almost a competition, right? You see everything that your friends are posting, and some of it's real and some of it's not real. And you begin to disconnect because that's not happening in your life, right? And I also find from my time on college campuses is that people just don't connect. They don't talk to each other, right? I mean, how many times do you see young people with their earbuds on and they're just on their computers and they're on their screen? So we have really lost that art of just conversing with each other, making connections with each other. And we connect with, an iPhone or an iPad, and it's our value and how we determine our network is based on how many likes you get. Mm-hmm. Right. So I think that's one reason. The other thing that happens is I think we have become such a transient society that, there was a time when family members stayed closer to each other, but now that we're dispersed all over the place, I look at my own family and I see that, I'm one of 7 siblings, and I think we all live in, so far from each other. It's very hard to stay connected. But I think that, families don't. When I grew up, at the end of the day, we had family meals together, right? We talked to each other. We shared what was going on in each other's lives. And I wonder how that happens. That doesn't happen, much today. So I think it's a multi-dimensional, there are many, many reasons why people stay connected, but I'm beginning to feel that social media is not as much of a savior in staying connections as we were led to believe it would be.
Yeah. There's a lot where you just shared so much because, so while social media is important to stay connected, platforms like Facebook, that's a very interesting dynamics where, like you said, people will post what's working well, or how they look on their honeymoon or their vacation, or or they begin a thread where it says, "I'm going to rant," or they start complaining. So they think of it as like a place to kind of just like, I call it mental vomit. It's just they use that platform in such in an interesting way. But I could tell you, I have aging parents, And they, thank God, we were able to give my parents an iPad before COVID, and we were able to teach them about Facebook. And then they were able to stay connected with family in the Philippines and, across the country and whatnot. And it was just such an eye opener, and it was such a blessing. But at the same time, other people, could use Facebook in different ways, just like as I shared with you, as far as like showing off or just kind of using it as a platform to just kind of like complain. It's just a very interesting life that we're living in. And I wonder what's going to happen to that segment of young people as they get older. How are they going to manage? I mean, I opened up this hour by saying that, it's being lonely is almost equivalent to smoking 15 cigarettes a day, and how actually loneliness and social isolation is as bad as being obese, and how all that can compound. And it's so I really worry, as my background is nursing. I worry about people's health. I worry about access to health. I worry about when they do get into the hospital system, who's going to be available to help them because there's been such a shortage. So, I really do appreciate our conversation today and the presentation and the task force, because it's so important. It's so important to bring awareness that loneliness is going to really impact your life. It's going to impact your longevity. It's going to impact relationship with others and also yourself.
Well, Debbie, I remain optimistic. That's why I think it's so important that we add intergenerational lens to all of the work that we do, and provide a space for older adults or for all generations to get together, right? To have these kinds of conversations, to make connections. One of the things that I truly enjoy, even with all the work that I do at ARP, I am often invited to college campuses to talk to young people. For example, I went to have a fireside chat with the iLab at Harvard. And these were young people who were developing apps, they were starting startups. And what they wanted to know is, how do I connect with an older adult or a person to make sure that I understand what they need, what their needs are, right? To make sure that they can use these devices, to understand how they're being used so that I can design a better product. So I remain optimistic, because I'm finding that young people are interested in helping to make a difference, right? And I think we just have to take advantage of that and bring them to the table as well.
I appreciate that. Thank you for all that you do. I honestly, I sincerely mean that, because we do need people who can be the model, the speaker, who can kind of help bridge lots of gaps to be able to, share what older adults can benefit from, and be able to be in front of those who want to serve them, the younger adults. So it's awesome. I know I have, my youngest is a senior in high school, and his high school history teacher is so excited. In the springtime, they're going to have seniors having tea. So there's a local senior center who's going to be invited. They'll take the bus and spend, an hour or two with the high school seniors, and they'll have conversations and tea. So, I love that concept, because it just kind of, for me, it's almost like bringing the circle of life together. To be able to learn from each other, to be able to have that level of connection is just, I was invited to attend to, so I can't wait. I can't wait to be a part of that. But you, go ahead.
That's wonderful. And I'd love for you to give some feedback on how successful that is, because that might also be something that we can share with other communities, right?
Yeah.
I'm not necessarily a part of, but I've seen that there's also another organization where they are having generations over dinner, where they have dinner parties and they try to invite or inspire as many different generations to gather around food, right, and break bread together. So I think that's a very interesting. There are just all kinds of little things that that can be done.
Yeah, so true, so true. I was talking with Marley Castley, the commissioner of Quincy's Health Department, and next, actually, it's tomorrow. I'll be offering self-compassion to help with resilience, and it's a 4-session program, and to talk about what self-compassion is and how it's okay not to be okay, and it's okay to acknowledge the fact that, hey, I am lonely, accepting that, and then be able to take a deep breath and say, okay, what's the small thing that I could do today to, lessen that feeling, so creating a space where people can kind of talk and realize that self-compassion is so integral to resilience, and that there's the components of being mindful and being aware of that, and reminding ourselves that we're not the only one feeling lonely, or we should not be embarrassed, or we should not be proud to ask for X, Y, and Z, and to offer ourselves self-kindness. And what does that look like at that moment? So I'm excited to be able to offer that, because it's just so important for human beings to feel that they're okay. Again, going back to Facebook, you see so many people looking so perfect and happy, and then to be able to see that, and then it makes us feel badly sometimes, like, oh, what am I doing wrong? So so I'm really excited to be able to offer that. But I noticed elements of that in your presentation, as far as what's been working well and what the organization has been really picking up on, to be able to offer different activities and different ways to be able to help people to be connected, to feel connected, not just be connected.
So important.
Yeah. So we're almost done with our hour here. What are just some key points based on what you shared with us today that you want people to come away with? Maybe like 4 or 5 different key elements that you want people at the end of this program to really remember this presentation by.
I think the first thing is to understand the value of connections and the health risk of being disconnected and lonely. And that if you're feeling alone or lonely, that it's normal. And there are ways that you can reach out, and there are people, community in the community that are available to help. I mean, contact your local senior center or your council on aging. I think remembering and valuing self and feeling good about yourself and the fact that we made it, right? And that we have a lot of experience and wisdom, and that can be shared, right? And not feeling that because you're retired or you have no longer have a job to go every day, find something to add meaning and purpose in your life. Get out there and share your community, share what you have to offer. I would say that I'm convinced that we're going to solve this problem. And I hope that the silver lining of COVID is that now that we all have a sense of what it means to be lonely and social isolated, that we remain committed to making a difference and making sure that those who are living alone, for whom loneliness is a way of life, that as we walk out to our new normal, that we remember those people and know that there are others that we need to help, and that we can help. We need to solve this issue together. So I think that there's just so much. And I think hearing and voicing your concerns, voicing this issue, making sure that our lawmakers are attuned to it, that they are aware of the issues and how it's impacting our individual lives as well as our neighbors and communities. There's lots of monies that are coming to communities to help make a difference. And I feel very strongly, and it's probably because I do the work that I do, that perhaps we should not overlook programs and opportunities to connect communities and community members. So I can go on, Debbie, but I think those are the kinds of important things that we need to learn, that we don't need to live in loneliness, and that working together and coming together to combine our resources for a great impact is what's going to make a difference in addressing this issue.
Yeah. Wow. That's great. That's wonderful. I'm just so impressed by what AARP offers and how it really looks out for the betterment of people out there. And is it just people 50 and up, or is it for the retired person? What is there like a cutoff that AARP, support as far as age-wise?
Well, certainly our issues are supporting people 50 plus, and making sure that people are able to make the decision on how they want to live as they retire, and making sure, for example, our communities are age friendly. I mean, when you look at the whole age friendly movement, it's the World Health Organization program that put out the call to action, because we've become an aging society, right? And communities need to make sure that, they're making changes to their cities and their towns and community. That includes having sidewalks or curbs that help people who are on, wheelchairs. And I, as a formal interior designer by training, I operate from the premise that good design works for everyone. And just as you're really helping to improve the design for an older adult when in a wheelchair, you're also helping, a young mother with a stroller, right? Mm-hmm. So as we begin to think about these things, then I think that we say 50 plus, but, I lecture at a local university where I talk with college age students, and, I think aging starts at birth, right? And 50 is too old to start saving for retirement. So I encourage them to take advantage of the opportunities we have and the programs that we have that encourage them to save for retirement. So I think it's there's so much. So we say 50 plus, but my sense is we've got a little bit for everybody, and encourage everybody. And you don't have to be 50 to become a member. So I invite you.
Aging starts at birth. I love that. I'm going to have to quote you on that because I love that. That is so perfect. So Sandra, if anybody wants to learn more about AARP, what is the website? And is there any other type of links that you want us to jot down in order for us to be a part of this movement?
Well, certainly you can contact us by the information I provided on Twitter or Facebook, and I'm trying to see aarp.org/MA. That's really always a good one. And if you have any questions about the task force, you can go to the website, and there's a place that you can ask a question, and someone will be in touch with you. And for those who are interested in being in touch with me, then my email address is sharris@aarp.org. So I welcome that as well.
Great. Well, I want to thank you so much for being on the program today. I really learned so much from you, and I look forward to learning more from AARP in the future. I also want to thank the Quincy Health Department for continuing to sponsor this program. My name is Debbie Lynn Toomey, Tufts Medical Center's injury prevention professional. I wish you a good day. I thank you all for being a part of this program. Again, Sandra, thank you.
Thank you. Let's stay connected.
That's right.